All right, everyone. Well, hello and welcome to our webinar, Ethics, Climate Change, and the Future of Work. The Center of Bioethics and Humanities and the Center for Health, Work, and Environment are so happy to have you all here and glad that you are joining us. This is our first webinar in a series on ethics and the future of work. So we're so excited you all are here for the first one of this series. We have a great group of panelists lined up for you today, and we're excited for some of the conversations that we'll be having. So just a few quick housekeeping remarks. This is a webinar series type of Zoom meeting, so all participants will be kept on mute throughout the duration of this presentation. So with that, please feel free to use the chat function if you have any technical issues. We will be moderating the chat and helping out with any issues you're experiencing. If you have any questions for our panelists that you'd like our panelists to discuss, please use the Q&A box. That way our panelists and our moderator can see those questions and try to get to as many as possible. This webinar will also be recorded and available through our YouTube channel so that you are able to watch it afterwards and share it with whoever you would like. And then finally, there will be a survey distributed at the end of this webinar. So please take a moment to complete that so that you can give us feedback. And if you would like to claim CE credits for today's webinar, you can also do that through that survey. So without further ado, I'd like to introduce our moderator, Dr. Lee Newman.
Thank you, Madison, and thank you all for joining us today. This is a great pleasure. I'm really excited to be kicking off this collaboration on ethics and the future of work with this particular distinguished group. So I'm Lee Newman. I'm a professor at the Colorado School of Public Health in the Department of Environmental and Occupational Health, where I head up the Center for Health, Work, and Environment. And as you can imagine, the future of work is very much on our minds, as are the issues around climate change. And one of the things that that became increasingly obvious to us is that we need to not only be thinking about the mechanics of what lies ahead in how we may adapt, mitigate, but also be thinking about from the perspective of its impact on workers and their communities and families, think about what are the ethical kinds of issues that we're going to be facing. And climate change is certainly front and center. So I'm very pleased to have this group with us today. Let me do a little bit of a preview of coming attractions. So we have four fabulous speakers with us today. We did a warm-up call a couple of weeks ago, and I've been just vibrating since then with questions that I hope will come from the audience as we hear from them. We're going to have each of them talk for maybe about, I don't know, a few minutes and share their ideas around this theme of ethics, climate change, and the future of work. And then we're going to have a conversation. We're going to be looking into the chat to see what kinds of questions folks have, and we'll take it from there. So hopefully this is becoming much more of a conversation than a bunch of mini lectures, but we want people to kind of peg for us where they're coming from. Let me do some quick introductions, and Dick, thank you for cautioning me to make these brief, because I could talk about each of these speakers for the whole hour and a half. First of all, Bob Harrison. Dr. Harrison is a public health officer with the California Department of Public Health and clinical professor at University of California, San Francisco. I've known Bob for centuries now. He's very well known for the work that he has done around worker health and safety, from the level of taking care of individual workers all the way up to major policy advances. His research as well as his practice have been really a guiding post for me in my career. So we're very happy to have you here with us today, Bob. Secondly, I want to introduce Cheryl McPherson. Dr. McPherson is a professor of bioethics in the Department of Clinical Skills at St. George's University. Everyone I talk to sings her praises as someone who, in the world of global bioethics, and in fact is co-editor and co-chair of various working groups and a journal, Global Bioethics, is the go-to person. She's edited the book Bioethical Insights into Values and Policy, Climate Change and Health, has authored many seminal bioethics publications on climate change. So we're looking forward to her perspective. So thank you, Cheryl, for joining us today. Thirdly, I'd like to introduce Dick Jackson. Many of you know Dr. Jackson, who is Professor Emeritus at the Fielding School of Public Health at UCLA, where he was department chair in environmental health science. He's also, among many other things, spent time as director of the CDC's National Center for Environmental Health, and remains very active in the National Academy of Medicine, especially around the topic of climate change. So welcome, Dick. And fourth, I want to introduce Cecilia Sorensen. Dr. Sorensen is director of the Global Consortium on Climate and Health Education. She's an emergency medicine physician and investigator at Columbia University, and is really one of, I think, one of our premier coming up and coming stars in really helping us translate research into policy, into clinical action and education to address the needs of communities at large, vulnerable communities, and in particular her work around worker health and safety in the face of climate change and things like forced migration. So we're going to have a great discussion here today. Let me start by asking Bob for some of his perspective on this topic, and then we're going to go to Cheryl, then we'll go to Dick, and then we'll go to Cece in that sequence. And if you have questions, we're going to be watching for your questions coming in, and hopefully have a great conversation. Thank you for joining us today. Bob, over to you.
Thanks, Lee. And it's a pleasure to be here and to join this panel, fabulous speakers and discussion that we're going to have. I want to make 3 points. The first is that, Lee, in your titling this The Future of Work, I want to push back a little bit because I think actually the future is here and the future is now. I was born and raised in New York, and my father was born in 1911. He grew up in the 1920s and 1930s. And that's, I hate to say it, really, it's 100 years ago almost. And I think he would recognize the world today, but he would also not recognize the fact that he could push a button and order something online and have it delivered from all over the world. He spent most of his life growing up within about a 10-mile radius of Brooklyn in New York City. And when I moved out to California, it could have been the other side of the moon to him. You know, we were still making collect calls. In the 1930s, when he helped organize the unemployed, about 30 to 40% of the American labor force was in unions. And today, we're down to about 6% of the private sector labor force and about 15 to 20% in the public sector. I don't think he would have recognized these features of the labor force today. He was an immigrant. He was the child of an immigrant from Eastern Europe. California, the 6th largest economy of the world, where I live, is a majority minority state with an incredibly diverse workforce, which is also very different and a feature of the future, the here and now of work. So that's the first point. You titled this The Future, but I think we have to be prepared to think today and now about these ethical issues, not off someplace in the future. And I think we're getting together a week after COP26 is over, dealing with some incredibly critical issues about the workforce globally. The second point, I want to highlight 2 critical sectors of work related to climate. One are outdoor workers. And here I'm thinking particularly of construction workers and agricultural workers, not only in this country, but globally. As the hots are hotter, these outdoor workers are going to be one of our vulnerable populations that from an ethical viewpoint, we need to be thinking about. And I think there's an opportunity to implement some broad structural and regulatory and public health programs to protect outdoor workers from heat stress and heat illness. And this not only includes not only the traditional heat illness and heat stress and death, but chronic kidney disease, which may be also linked. We maybe talk about that a little bit later. And the second population are the wildland or the firefighters who are off fighting the intense wildfires that we've seen explode all over the world. In California, for example, our fire season is now almost a month and a half longer. We've gone from really the idea of seasonal to almost year-round fires with implications for the health of a very large sector, the wildland firefighters. The third point I want to make is that as we think of transitioning from a fossil fuel-based economy, there are a number of ethical implications for the workforce. One are how we think about these new jobs that are emerging, whether that be in solar or wind power, battery manufacture, electric vehicles. How do we make these jobs, how do we ensure from an ethical viewpoint that these jobs are not only well-paid, well-trained, but they're also safe? And this is, I think, a global problem. I was very intrigued by the recent story in the New York Times that came out over the weekend on cobalt extraction in the Congo. I own an electric vehicle. I was proud, early adopter, making my own little contribution. I honestly had no idea that there are about 10 pounds of cobalt in every electric vehicle, and most of that production is coming from Africa, with the largest mines coming from the Congo. These large mines are now predominantly owned by Chinese. So how do we collectively think about protecting the safety and health and the ecology, by the way, of the environment as we transition to a green economy and rely on these precious metals? So those are the 3 points I want to kick off with.
Wow, we're going to have a lot to chew on, aren't we? Thank you so much, Bob, for that kickoff. And Cheryl, let me turn it to you.
Leah, it's great to be here. And that was actually a really great segue into what I want to say. So I want to start by, I also want to sort of hit 3 highlights to start off. And I also think that the past and present are really valuable to thinking about the future, but that's an aside. So my 3 points deal with ethics, climate change, and globalization. So first of all, ethics. No matter what the ethical issue, whether it's an individual patient care problem or a clinical trial problem or any issue, the questions that we ask about it come down to, well, who's the responsible protagonist? What were their motivations? Who was harmed or who is threatened by this? What's the circumstances? What can be done to alleviate it or resolve or rectify or compensate? So it's responsibilities. It's ethics for me is all about responsibilities. So that's the first point. I think many people look at or think climate change, well, what's that got to do with ethics? And not the least are those actually in bioethics, unfortunately. So just to kind of draw the connections, climate change, we know that it's causing the harms that it causes to environments and to human health presently, in the past, and on into the future. We know that it's undermining our well-being for the present and the future. And we know what's causing it, at least probably 99.5% of it. And what's causing it, the obvious answer is human actions. But I think from the ethics perspective, we have to step back from this human actions and think about human choices, and particularly about the choices of certain protagonists. It's not the individual consumers who have the power to make change. we can all do our part, and I certainly do mine in my choices as a consumer, and I hope all of you do too. But that's not going to change things in any meaningful, significant way. It changes how we feel about who we are and what we're doing. The change has to come at a much higher level. Those who are more accountable and more responsible for causing climate change are really industries, corporations, and governments. So those leaders are the individuals whose choices are impacting all of us. So that's a huge ethical concern about climate change. And then just to think a little bit about globalization, some of the drivers of globalization really are economic and political forces with their own interests. And primarily those are the entities that I mentioned: industries, corporations, and governments. And those also happen to be major employers around the world. I'm sure somebody has that information of how many, or could compile it. I don't know it, but clearly those are major employers. So their workforce is affected directly by all this, and their productivity, as well as the well-being of the workers and the workforce and the rest of us. So I didn't want to overextend on my opening remarks, so I'm going to stop there.
That's great. Thank you so much, Cheryl. And I think we're going to get to spend a fair amount of time thinking about these issues of choices and responsibility and globalization. And I see Dick already nodding his head, because I know that since recently becoming emeritus, he's just telling me that thinking about where he can put his energy to best use, this is exactly where he's focusing. So Dick, let me turn the stage to you.
I'm going to start with a quick story. Like Bob, I grew up in Newark, New Jersey. Actually, my mom and my dad was a fighter pilot who died at age 27 of polio, leaving 3 kids, and grew up like that. And suddenly, and especially in North Jersey, the environment is an absolute reality. I ended up going to medical school. I got into medical school in San Francisco, and in pediatrics, I remember in the intensive care nursery seeing, and I'm not making this up, 3 babies in a row from the Fresno area with quite severe neural tube defects. And then a couple of weeks later, the same thing with a different set of defects. And partly because of the New Jersey thing, I kept thinking, it's got to be something in the environment. And it was also 1975, and we were thinking a lot about environment. So instead of doing infectious disease, I ended up focusing more and more on environmental health. My first job with the state health department, where I met Bob, was I was the pesticide doc. And I kind of didn't know that much about it, and suddenly realized that this was more complicated than pharmacology. Everyone, typical organophosphates got 5 negative impacts, not just 1. They're often used in cocktails with about 5 other chemicals. And very quickly, I was going out and investigating clusters of farm workers made ill. I remember going out one time, and there had been about 100 farm workers vomiting in the field and taken to the emergency room. And of course, I spoke Spanish poorly, but we would try and figure out, they didn't even know where they were working, a lot of them. They were picked up by a labor contractor, and what was on the leaves. I said, well, there was white powder and brown powder, and so it smelled bad, and my eyes burned. And quickly discovered there were about 5 pregnant women in that group who were poisoned. And oftentimes, particularly where there's piecework, like carrot harvesting, there were children in the field. And so more and more, I began to realize that the whole regulatory system, and it relates to what Cheryl's talking about, the regulatory system was focused on protecting 70-kilogram white males sitting on the couch and not on highly exposed workers. It was endlessly frustrating. We could not get the grower to say that was being used. They didn't have to tell us. We could not get the applicator, because oftentimes the chemicals are put on by aircraft, really to disclose unless we really had the ag commissioner leaning on him. And so about 3 different times I was working with the California Rural Legal Assistance. And by the way, this was completely deviant from my government job. I wasn't supposed to be lobbying with these people. We pushed forward some bills to have full disclosure of pesticide use, to have closing of the data gaps on the chemicals being used, cooperation in the investigations. And at one point, my friend Marian Moses, who Bob knew well, she was the doctor for the head of the farm workers union. She says, Dick, you're just doing trickle down public health. You're way up there dealing with politicians, and you're not dealing with farm workers who are so sick, and you're not caring for them. And to make a long story short, it took a lot of work to put the laws in place that would fill the data gaps. And by the way, when California started to fill them, the rest of the country had to fill them, and the rest of the world got to know that data. We put in a law to require full reporting of pesticides, and it's something that needs to happen across the United States, not just in one state. We put in place a birth defects program and a cancer monitoring program as well. And that's like 25 years ago. But the important thing from this is it's completely opened the door for much more effective and powerful advocacy and research. When I went to CDC, I pushed very hard for the biomonitoring of chemicals in people. We started out doing about a dozen things. Now we were up, by the time I left, we were up to about 500 chemicals in a droplet of blood. So bringing data to the shore. So to make a long story short, after I left CDC and retired from UCLA, I became obsessed with the fact that I spent my whole life worrying about little stuff, and what will kill more people than anything will be climate. And when Armstrong landed on the moon, the population of the planet was 3.5 billion. It is now 7.6 billion. There are 90 parts per million more CO2 in the atmosphere. And for example, the whole Southwest of the United States is short on water. And once in a century floods and storms are now occurring about once every 5 years in many parts of the world. When I was at CDC, and Celia will appreciate this, one of the groups was the Refugee and International Health Group. And I kind of thought, well, you go out and we were the kind of the county health department dealing in refugee camps. And when the folks came back, they said, Dick, the worst part's not the water, it's not even the food, it is the complete political disintegration where people are set up to be victims of the most terrible situations. And so in my work in India, I was on the banks of the Ganges in Bihar state in India, doing smallpox eradication. And with the loss of the Hindu Kush ice fields that supply water to about 13 countries, there is going to be major population migrations and the rest. So to make a long story short, upon my becoming emeritus, I have completely focused on the National Academy of Medicine and getting them to step up. And a friend of mine said, well, wait a minute, doctors can't do anything about this. They're just seeing too many patients already a day. And I said, no, the medical care system is 17% of the GDP. It's 10% of the US workforce, and it's about 9% of the carbon footprint of the United States. And we have no business telling anybody else what to do unless we're taking care of this ourselves. So I think it's important to be turning the screws at the highest levels, and of course at the very personal levels of the farm workers who in California will soon be working only at night under bright lights, because it's going to be unbearable in this. And it is already very difficult, but it's become worse. So working in these environments will become a real challenge. Thank you so much for having me join you.
No, thanks, Dick, for those comments. And let me now turn it over to Cece, who I think has a lot to share that builds on that thread, Dick.
Yeah, thank you so much, Lee. It's really an honor to be here among so many incredible panelists. Dick, I'm sort of, absorbing the story you just told and thinking about, your career and your experience and how climate change has now become this focus of someone who's done so much such important work and now is seeing climate change coming. It's sort of, we're talking about the future of work, but the future is here because we are 40 years too late on climate change, right? We should have been having these conversations 40 to 50 years ago, and now we're having them today. So that's why I feel like the future is now here. So, I kind of have three main sort of buckets of concern as it relates to climate change and worker health. The first one is really thinking about these intensifying exposures, thinking about heat, thinking about vector-borne diseases, extreme weather, and air pollution. When I think of workers, I think of them as being the climate canaries, right? They're exposed to conditions that other people and the general public can elect to avoid, but that workers must endure because of the nature of their profession. So they are our climate canaries. And when we start seeing climate sensitive diseases, I expect we're going to start seeing them in workers. And that kind of speaks to the CKDU issues and the heat stress and the nephropathy issues, which we're already starting to see in many different parts of the world. When I think about climate change, I think that this is a threat multiplier, right? It takes existing disparities, existing vulnerabilities, and it makes them worse. And as other panelists have sort of referenced already, we already have vast disparities in terms of worker safety, both in the US as well as globally, and climate change is going to make that worse. I think my second main bucket is really thinking about emerging industries resulting from climate change. And that kind of comes in two flavors. One of them being this emergence of green industries, as Dr. Harrison sort of referenced. There's a lot of pressure right now to make this rapid transition from a fossil fuel-based economy to a green economy. And so industries are setting up overnight, and there's just massive expansion happening so fast that I don't think that we can really keep track of what these jobs are, what people are doing. In the US is one thing, but then overseas is another thing. I read that New York Times article, Bob, thinking about cobalt mining in the Democratic Republic of the Congo. I mean, like, whoa, right? Like, what are the worker safety issues associated with that? Thinking about lithium mining in Bolivia and other parts of the world where we are relying on the extraction of trace rare minerals to fuel this rapid green transition, and what that means for the people who are actually doing the extraction. The other sort of new industry that I've been seeing develop is this disaster chasing industry. There was a great New Yorker article about this. In 2020 alone, there were $22 billion climate related disasters in the US alone. That's 22 disasters that each led to over $1 billion in damage. That resulted in roughly $200 billion being dispensed by insurance, as well as federal payouts for reconstruction and remediation. And as a result of that, these large firms are chasing these contracts to go into communities and help them rebuild. Who are the workers who are going into these communities? Well, they're often undocumented, they're often highly vulnerable, and they're being exposed to a lot of very unsafe environments. For example, their job is to clean up, this toxic spill that came out of some factory, right? What are those toxins, right? We have no idea. It's that powder on the leaf that no one knows where it came from, right? But not only are they being exposed to those, they're chasing disasters, right? So similar to how agricultural workers move around the country as crops, go into season, this informal sector is following disasters, right? Being exposed to multiple different God knows what type of chemicals, right? And then they show up in your emergency room or in your office and they're sick and you've no idea what they've been exposed to. So those are kind of the two flavors of new industries that we're seeing develop, the green industries, as well as these disaster sort of remediation industries. And I think, the last thing I think about in terms of worker health and climate change is thinking about labor productivity and labor demand. Just over the past 20 years in the US alone, we've lost billions of dollars in potential labor due to extreme heat alone. And so the question is, who absorbs that cost? Are these workers who then therefore couldn't work and then therefore couldn't get paid that day? Who's taking the hit for this? Is this companies or is this workers? And I think that that's a really complex question, and I don't think we know the answer to that. And so, thinking about labor productivity and how workers are going to be able to manage, the environmental conditions of a changing climate, but then also manage, their ability to find meaningful work. As we transition to a green economy, are we also, thinking about how we can retrain workers so that they have continuous work, right? So they don't have huge gaps in their ability to work because coal facilities are shutting down and they don't know how to build windmills, right? So we have to be thinking about that. So I'll stop there. Over to you, Lee.
Great, thank you, Cece. And I just want to tell people that we'd like you to please feel free to use the Q&A function for any questions that you have. We're going to now move, now that we've we've thrown down the gauntlet. We're going to have a conversation here over the next hour, and this is an opportunity for you all to participate in this. I have a few questions for this group to get it started, but I'm hoping they're going to start asking each other questions here, because there are some points of where I think that we need to probably challenge ourselves to figure out how we get into that future if the future is now. I'm very much a pragmatist. I've spent the last 6 years focused on this issue of chronic kidney disease, this CKDU, which we know is related to heat, but heat plus other kidney toxins combined. We're very concerned about its effect on productivity, and as Cece mentioned, and we're also concerned that when you lose productivity in the agricultural sector, you're compromising food security for the planet. So, I see how these threads all connect between climate change, rising heat, places where people can no longer work, and their personal health and their productivity rolling together. But now I want to come back to something that Cheryl said to kind of kick off the conversation here. Something that you said, which I think is extremely important for us to pursue, is this, if you will, kind of the locus of control over what happens next and the responsibility that we have. And I heard Dick talk about healthcare, and maybe it's the scions of healthcare who have responsibilities in that sector. We've heard about these other sectors as well, but I want to come back to and just pose to everyone, based on the comment from Cheryl, if we see at the highest level it being about industry, about companies, and about governments, and the responsibility, the choices that need to be made, and the responsibilities. Where do you all think that we should be, putting our energies right now as a scientific community, as a public health community, as a worker advocacy community? And as I told you all, I didn't prepare this panel for the questions that I would ask. So, it's okay for them to take a minute before they want to jump in. But where do you go next?
I'm going to jump in where angels fear to tread here, Lee. In terms of workers, we've done as UCLA a fair amount of work around the Port of Los Angeles, and LA worked very hard to reduce its air pollution levels, as did California. And as you know, right now, we've got about 100 ships waiting to unload. And I listened to all this whining about what's going to happen. People won't have enough Christmas gifts and all this sort of thing. And as those ships unload, by the way, the TEU was about $2,000, these big containers to move across the Pacific. Now it's $17,000. And the worst air pollution in LA now is coming from both the port itself, the ships, and the trucks that are going through some of the poorest communities there. And the supply chain, as we have set it up, is destined to fail. It's one of the things that we move into farther into the 21st century. We have got to bring back a whole lot more jobs. And I say that for reasons of safety, reasons of politics. If you fly into Los Angeles, that your aircraft will, as you come in from the east, will go over mile after mile after mile of warehouses that are being supplied by trucks coming up from the port, and the stuff sits there and then is moved across. Think about the carbon footprint of all of that. Why couldn't we have been producing and giving jobs in all parts of the upper Midwest, the so-called Rust Belt and elsewhere? So I don't think anybody even thought about it. Talk about government back when we were signing these agreements back in the 90s. But we did not really think about the impacts at this broad a level, except for maybe the young kids that were rioting in Seattle at the time.
Lee, I would add labor rights to the equation that you mentioned, or to the description that you mentioned. I think you said government and industry, and I would add labor rights to that. I would add the essential connection between the right to organize, to represent, to participate in this process as we think about climate and the impact on the workforce. And it's obviously a very huge question that predates climate change by hundreds of years. And from a historical perspective, probably needs to go back to the collectivization in industry, the gathering of workers in factories, the deployment of capital in the United States and then globally and now internationally around the world. And the question is how to link, I think, labor rights in the future economy with the health question, which is really getting back to the title of this webinar, isn't it, now that I think about it? And on a practical basis, what are the kinds of steps that we can take to ensure that workers who are producing for the global economy are protected?
Yeah, well, Bob, thank you for that addition to Cheryl's list. I think it's really an important point. But here's where I struggle. We use words like informal economy like it's a thing, and it's billions of individual things. It's workers who are seasonal workers who do not have necessarily steady employment. Who, back to the question about responsibility, there's not organized labor in many parts of the world to represent those rights and those needs of those workers. So how do we reconcile having billions of workers who are working in informal economies and meet these grand goals that we have for protecting them from the impact of climate change? How are we going to do that?
Yeah, Lee, it's a hard question. And, one of the things I think about is, this idea of, this right to a healthy environment, right? A right to health. And, of course, exposures happen at work. They also happen on your way to work, right? And so it's, even if we were to be able to regulate the work environment, people still go home and they're going to be exposed to degraded environments. And so, when I think about, how do we protect workers, you think about how do you protect everyone, because everyone is a potential worker, right? We're all workers. I'm working right now, right? How do you protect everyone? And it's, one of the sort of the ethical things behind this is really, people should have a right to a healthy environment. And so how do we work towards that, as a sort of a global community, thinking about climate change and thinking about, this increasingly toxic environment that we've created, that we live in?
And I'll just respond to that too, Cece, because this is the thing from the perspective of ethics, is that everything is so intertwined. And so when there's for example, I'll give you my local example. I live in the small island developing state of Grenada, which is a lovely, beautiful, relatively unspoiled, warm, hence the short sleeves, place, and very small. We have about 100,000 people. Well, over probably 30 or 40 years, the local agriculture, it's a very lush island. There was very little hunger or diseases of malnutrition here because food was plentiful, if simple. And we've moved to a supermarket world here. And so I think Dick mentioned the shipping holdups with the ports. That's affecting Grenada, and it's affecting supermarkets all over the world. It's not just in the United States. We're not seeing a lot of things coming in. I was talking to a friend this weekend who's actually in the restaurant business, and he was saying that some of the hotels that are trying to build are unable to get the concrete and the materials that they need. There's backlogs. There was a company that had tried to order long life milk, and it was such a long delay. And then when they finally got access to it, the the cost of shipping and quote storage, I guess, skyrocketed thousands of dollars more than was planned. And so now they're trying to cancel this, and of course, all sorts of legal battles. But I think this comes back to this idea that we're all workers. And so, for example, when you don't have food and you get whatever diseases of malnutrition or lifestyle diseases, you get obesity, you get heart disease, you get diabetes. Diabetes is very prevalent in the Caribbean. And you go to see your doctor. Well, the healthcare professionals are all affected by this in terms of what they see. And I think, Bob, you had mentioned healthcare. Well, that is a huge contributor. It's very well documented. That's a huge contributor to global greenhouse gas emissions. And of course, outside of the United States, healthcare is provided through governments primarily. And it's also interwoven. It's very hard to know how to tease out, Lee, to answer your question. And how do you tease out what to choose, what to do, what's going to make a significant difference in the picture?
Well, I appreciate that, each of us are identifying particular industry sectors where, we feel like we can hopefully have an impact. And I think that's important. One of the things that I want to take before we go further down that path, I do want to take some of the questions that are coming in through the chat. And one of them, just to circle back, because I think Bob, it kind of was stemmed from something that you said. Question was, how are we going to reconcile workers' rights in the US when large companies have standard practices preventing organized unions? And we probably can extend that question internationally as well.
It's a great question. From the point of view of a healthcare person who's worked in trying to promote better health and safety on the job for my career, the groundswell of pressure usually comes from the bottom up. And my job, and I think our jobs, I would argue, is to highlight and to publish and to distribute the scientific information and work with groups that are organizing in a collective way to pressure our government and our policymakers and our academics to put in place the protections to make it and to enable those groups to organize and to exert locally and then globally to make those kind of policy changes. So as a kind of a philosophical structural way, that's the plane upon which I think we work. Because I don't feel that I can push a button and say, I am going to change the nature of global capitalism. I would like to someday when I wake up in the morning, but that's not the stepwise and the organizational structure. I didn't answer that person's question directly, but I think in terms of the kinds of ways in which we have to form coalitions and collaboration, that's what I look for.
No, thank you for that. Dick, did you have something you wanted to add?
I completely agree with Bob. We've got to develop the data. We've got to get the data to people that can have influence and make these decisions. But I have learned the hard way, it's not enough. And until we can really reformulate the data in ways that the worker can understand, the average person can understand, the busy legislator can understand, and just we too often publish our stuff and go off. And I'm gonna, I was talking about the thing with the farm workers. I swear that the thing that probably changed California policy more than anything was a hearing we had with a child of a farm worker who was born with tetramelia, no arms and no legs. And We had 3 or 4 camera crews from major networks during that hearing, and the bill that we were trying to pass had been killed twice because it was sent to the Agriculture Committee. And we had to play hardball in order to get that bill through. And they were agitating to get the governor to veto it. We finally got it to happen. But thinking that staying in our little medical health, public health groove is going to do it is not successful. And I'd be interested in what Cheryl has to say, because I suspect there might be some health ethicists that would say what you're doing is unethical. But at the same time, continuing the terrible situation that it was for the next 30 years was unethical as well. So I'd like to, I think getting out of our traditional groove is going to be very important. And I give a lecture that says, you know, in California, the 5 most challenging things to health is water, because we're not going to have enough of it. 2 is power and the misallocation of power in our society. And I go on, but the 3rd one is greed, and the overwhelming greed, both in the medical system and the corporate. I love the fact that Walmart, when they bring people on, teaches their workers how to apply for food stamps and subvention to keep that family alive, because they can't live on a salary when they're working that hard in those factories. So I think just staying there and thinking it's going to fix itself, we're wrong.
Yeah, Dick, I mean, sort of thinking about what you were saying about, you know, medical providers staying in their lanes. You know, I'm running this consortium for climate and health education at Columbia University, where we're really advocating that, you know, health professionals, nurses, doctors, pharmacists, public health workers need to have a background in climate and health. But one of the skill sets that we really try to propagate is that, you know, doctors and nurses need to learn advocacy skills, right? Because what you just described about going to a courtroom and being part of this case, I don't think a lot of people know, first of all, know they can do that, or 2, have any you know, framework for even seeing examples of that and how it's been successful, and how, you know, how health professionals can even play that role. So I would love to see is, you know, having that type of education be part of medical schools or nursing schools or public health schools, so that doctors of the future, and even ones now, actually know that they can do that they should do that, and that they have the skills to do it, you know. And I think that takes a huge culture shift, right? Because, you know, doctors and nurses, they want to stay in their lane. Like, I just take care of patients, I don't deal with politics. But I think as we're coming into this future, this now of really a lot of human rights issues happening, that we need to start expanding our skill sets and working in zones that are less comfortable. So
something that Howie Frumpkin and I did really pissed off Francis Collins, the head of NIH. And we wrote an editorial on a bunch of things. One was in Scientific American. We said we need a new Institute of Climate and Health. And I swear you could go investigate some small enzyme in some cell in the lung and get a full career support. But if you want to do what Cece is doing on climate, or Aaron Bernstein is doing, there is no support system whatsoever. And every medical center in the country needs to have a program similar to the one you have in Colorado. And every medical student ought to easily get this information and the support as they finish up. And maybe even some, you know, a K award or something else as one goes forward on this, because if you really want to change things, you have to have the people. It's fine to have the words and the speeches but if you don't have people muscling this, it's not going to change.
Dick, I appreciate that comment. You're singing a song of mine, because my first career was as a journalist, and I left that to do something crazy like go into medicine and then the public health. I want to say the same for public health professionals. We teach a course in our school of public health on. I teach a course on public health communication, and it's just the raw skills. How do we do a better job of speaking to an audience that is not a scientific audience, that we're not just here talking to, you know, each other, like kind of like we are today? You know, how do we break it down into something that resists the jargon and the gravitational pull of writing in a way that, you know, gets the next grant, and in fact is about making, helping to effect change in practice. And it's a struggle. where we spend a lot of time being trained to speak in what most of the world thinks is gibberish. We're trapped in our jargon and our way of speaking. But I want to shift to something which I think is kind of an ethical dilemma that we face, which is that even when you can perfect your elevator speech about why climate is right now harming workers and why that's bad for you and I, even while you're perfecting that, there's a key intermediary here, and that is the media. And I'm interested in what people think the responsibility, the ethical obligations are for the media to, if they're not on the page, be on the page, instead of what they habitually do, which is to look for, what's going to sell my story today, what's going to get me traditionally above the fold with my story, and actually, what is their ethical obligation, if you will, to help transmit the message that we have. If we have something to say about climate and its effect on health, if you train every doctor and every public health practitioner in the country, in the world, we may not get access to the people who need the message. How do we do that, and what's their responsibility?
So I'll take a crack at that. I'm sure we all have our own views on this problem, and I certainly have mine. But what I can say aside of that is that, so my brother has spent many years in the field of journalism, and he and I talk a lot about these things. And he says, so I made the claim to in an informal conversation with him that part of the problem was that we're corporate cuts, saving money, cut all the staff that know anything, put in junior people who don't, and so that was my argument. And he said, well, it's not exactly that. It's to do with the use of AI. And AI is now standard in newsrooms around the world. And a lot of the news we get is AI generated news, and even AI written articles, or at least a good chunk of them are. So this is an issue for future of work as well, because I know that's a huge trend in the way work is going. And I know this is a concern for all areas of work, including healthcare.
Lee, I would make a couple of points. First of all, the importance of independent journalism. There are many parts of the world and that's not the case. I'm fortunate where I can wake up in the morning and I can read fact-based, excellent, in-depth journalist exposés and investigations like the one that just came out this past weekend in the New York Times, but there are many others, and I have been incredibly impressed with the quality of independent journalism in the last 3 to 5 years. I have joked with some of my journalist friends that I am going to be printing out honorary public health degrees, either at the master's and sometimes at the doctoral level, with the kinds of descriptive and sometimes even more in-depth analysis of data that's coming out in these in-depth stories. So the last point is that I think partnering between academic and research and journalists is something that we should be working on. I think there are really good models for doing that, in which not only do we get to disseminate our research, but that we can assist journalists who are doing analyses of their own and provide the scientific advice and expertise. I think as we think about the future work and the covering of these stories, and I think we need to think more creatively and overcome these barriers that I think we traditionally think of between, sort of the academic ivory tower and the journalists, many of whom, we sometimes think, oh, I've just got a call from a journalist. So the last thing I want to do is pick up that phone. And it's sometimes the first thing I should do to pick up that phone and to provide that advice and expertise.
May I reinforce what Bob's just saying? I worked at CDC starting in 75, and I went back for another 10 years. And the transition within, if you will, governmental public health has become much more hunkered down. Now, if a journalist calls CDC, they're put on hold forever, and then they talk to some flack that's up in a director's office who doesn't really know anything, and they've got to fight like hell to get to talk to anyone, even if they're talking about a lowly fungus or something else. In fact, the National Center for Health Statistics, NCHS, was often called the National Center for Health Secrets because it was so difficult to get really critical, and a lot of it of enormously socially important information out. And once it was cleared by 85 people, each one of which had to send something back and correct a comma, it would eventually get out, and it was totally irrelevant by the time it came out. So I want to just reinforce what you're both saying, Lee and Bob, and all of you.
So let's move upstream with one of the questions here about the data and the research. We've talked about now the need for us to be able to communicate it effectively and having partners who are willing to take those stories and run with it in the kind of new and evolving partnership model with the media. But let's move upstream. The question is, who is collecting the data and actively doing research on climate impacts on workers? And let me tell you what I love about that question is that I have felt like in the reports that have come out on climate change, when you read them, they continue even today to say relatively little about workers. And part of that's coming from the lack of research, I think, and some of it is just a perspective that doesn't sort of almost understand that one of our largest, most vulnerable populations are workers. But let me ask the question. Now that I've sat on my soapbox, who's collecting the data and actively doing research on climate impacts on workers? So we got crickets here, right? And the reason I think we have crickets is because the answer is there hasn't been funding for that kind of work. Up until now, when we've wanted to get that work funded, we had to actually disguise it. We didn't use words like climate change. And frankly, we had to disguise the fact that we were studying workers because there was a lot more funding for looking at populations than there was to look at workers. So that's my pitch back to you. But Dick, do you have a thought about that?
LA, Los Angeles, some of the Sean Hecht and other folks are looking at very fine scale GIS and heat maps. And it turns out those heat maps are extremely useful politically because politicians are very good at reading maps and knowing what that means in my district or something else. But honestly, and you've just said it, Lee, it's built on the back of sort of a general public concern. In fact, the pesticide wars, a lot of that was succeeded because the wealthy people on the coasts wanted to have pesticide-free food, and you had to pitch it as something that was good for them rather than the fact that it protected farm workers who were literally getting 1,000 times as much chemical exposure every single day. So can I just also mention that probably one of the most important, in my opinion, health in the built environment and climate change studies came out in the New York Times Sunday magazine about 8 months ago, where they looked at redlining from 3 generations ago and then rates of disease and heat and other such issues. And it was fascinating that it came out of the New York Times magazine and not out of a prestigious NIH-funded organization.
Lee, I think your question highlights the need to build, maintain, sustain a robust research and public health infrastructure to look at the health impacts of climate change. I think there's a tremendous amount of activity and published papers. I haven't done a literature search on, for instance, workers and outdoor heat. But the last time I did it, I noticed where 10, 15 years ago, I would do that PubMed search and I'd find a few lone research papers. Now I find many more from around the world, which is to the good. And I think it's terrific, and that should continue. But what I also notice is that if you were to ask this question in this country, just in the United States, never mind other countries that are even hotter than the United States, what is the annual count of heat-related illness among outdoor workers? And what are the risk factors, and what are the areas that are disproportionately impacted? There would not be a systematic answer to that question. There is a mechanism to do that. There are state, local, federal public health agencies, all sorts of fabulous researchers around the country who could form a partnership. It's not rocket science to develop and implement that program. It's a matter of political will, of making the case that that is important, not only in this country, but never mind globally, how to answer that question. I remember, for example, Lee, you showed me your research on CKD in Central America and the relationship between heat and chemical exposures. And I asked the question, do we have that problem in California? And I'm a public health official, and I'm ashamed to say, I don't know. And if you ask me, well, why don't you know, Bob? I said, well, okay, here's why I don't know. And this is what I need to do to be able to know. And there are some very specific steps along that pathway. We just need to be working harder to make that case.
There is, Cece, did you have a thought?
Oh, no, I was just going to chime in and say, I think even when we're looking at a population level on the health impacts of climate change, we need to get more robust there. There has been such little funding in this space. I'm actually doing a study right now looking at the past 10 to 20 years of federal spending on climate change and health, and it's a 0.5% of budgets. I mean, and even less than that. So there's just been so little funding in this space to look at even general population health, not let alone worker health as a piece of that. But I think, like what's being said is that, the pieces are there. This is not something that we can't do. There's, this is conceivable. The question is there the funding to do it? And is there the will to do it? And that's what we're lacking, honestly. And so then stepping back from that, saying, well, then how do we communicate this need? And the fear is that, are we gonna have to wait for things to get so bad until we finally start tracking the stuff? So that's my worry.
There's an interesting comment in the chat saying that fear of liability hinders companies from doing these investigations themselves, and that's part of the issue. And I think that's a really very astute comment. So Bob, why have we over my group over the last 6 years been able to make significant headway in understanding how heat exposure is associated with productivity and kidney injury? We did it because we had a multinational corporation actually stick their necks out and say, we want you to come in here and help us solve a problem, which is that we have about 6% of our seasonal workforce starting the season with normal kidneys and ending the season with kidney damage. And we want to fix that. You don't hear that every day in the US. It's very hard to gain access. And I think there are probably lots of barriers to that. And so we do secondary data analyses. We try to be creative how we work around it. And but Malia asks the question, how do you best involve workers themselves in advocating for policy change? And how do we engage these stakeholders if we want those relationships and we want to be able to do the primary research? So I'm wondering what people's thoughts about, are there better ways that we can do that? And it doesn't have to be in the U.S. I mean, there happens to be, we're here in the U.S. talking today, but how can we better engage the workers themselves so that we're not sitting here, being perceived as ivory tower people thinking about what's good for them? How do we engage?
So I'll bring another sort of somewhat international perspective to this. First of all, I'm not sure that it's the workers themselves who need to be advocating and bringing about change. As we've seen that they're certainly the vulnerable ones. They're the ones who need a job, and I think it's not a mistake to involve them, but I think it's a mistake to put the onus on them, the responsibility on them. And then on a more positive note, some of you may have read about Andrew Forrest, who's a iron ore steel magnate in Australia, and this was another New York Times article, which was very encouraging. So here's someone who has made billions, really fundamentally through mining, and for whatever reasons, he's decided he's had enough of doing the climate change damage and doing the ecological and environmental damage. And he's decided to go make his entire company go carbon neutral or greenhouse gas emission neutral by 2030 through a variety of means. And I think of the coal miners in the US, and who, in my mind, until I read this article, I thought, well, these are people who all they want is their jobs. They don't believe in climate change. They just want their job. And according to this, he pitched this to his workers as, we're going to retrain, we're going to keep you all, we're going to retrain you, and you're going to be part of the solution. And the interviewer who spoke to some of the miners and electricians and others reports that they were like very happy because they were A, relieved, they're keeping their jobs, and B, they actually felt concern about climate change, and they felt like now they don't have that guilt hanging over them, I guess. So it was a very hopeful hopeful article.
Yeah, I saw that article, and I was going like, what? There's some good news out there. Other comments?
Well, the other piece of good news is, and I found this with the Academy, which is the old docs really get it. And I think it's because when you become a grandparent, your frame in life changes a lot. And the young docs get it, but they're so loaded with debt and demands and career placement, and if they're in academia, the academic ladder. And I was reading that one of the things that frightened the representatives, the politicians in Glasgow 2 weeks ago, was the turnout of young people and how much further ahead the young people were from the so-called leaders. And it might be interesting to think a little more about that, because I think it's a very important pivotal time we're at.
Which comes back to a matter of communication as well, Dick. How do we reach youth with the message?
At this point in my life, most of the talks I give, 2 of them will be at Berkeley in the next week, is to young people ready to step off in their career. And I'm going to tell you outright, I tell them, look, you got to go deep on something, because one of the big things that comes out of education is learning what you don't know. And every time I have Tucker Carlson, or, you see someone like this and they've got all the answers, watch out, because they clearly are inadequately educated. And you have to, as a young person, go deep on something just so you can appreciate the complexity of the world. But then you have to speak up. And there's so many forces. I see it in government and academia and corporate that tell you to shut up. And it's time to stop shutting up and to be much more aggressive about what's right. And I think it goes right back to, Cheryl, I spent several years in the Jesuits, and I didn't get too far into moral philosophy, but I think that the ethical moral side of this is very cogent. And I think deep down inside, even the electricians in Australia understand this part, and it's very important.
Lee, I wanted to raise one other issue that we haven't touched upon, maybe in the last couple of minutes, and that is the unprecedented numbers of individuals who are in migration or will be from country to country, and the potential impact on the nature of work as those individuals arrive or seek employment. I think it's going to be pretty profound on so many levels as we see this unfold in the next several decades. And I've been thinking about how do we even understand the impact on health generally, not just only on the workplace. That's a specific question, right? What kinds of work are these folks going to be doing? But also health in general in the communities, and how do we provide those healthcare services? I don't know, it's not a space in which I've read or done research in, but I want to raise it because I think it was brought up at the very beginning of our panel. Do we need to be thinking of better ways to prepare or understand or track this impact over the next future? Because that is going to be future. And are people aware of work underway to really understand that question?
Well, and I think we can anticipate with extreme weather events as well, that as well as just land no longer being usable for other reasons related to heat, drought, that we're going to have even more climate refugees than we have today. And I know, Cece, this is something that you've given some thought to. I don't know if you want to weigh in on this subject.
Yeah, wow. I mean, the issue of environmental migration is just gigantic. There's some data from the International Displacement Monitoring Center that there were roughly 17 million new displacements in 2019 alone due to environmental disasters. So it's 17 million people were displaced because of floods, droughts, et cetera, et cetera. So, I mean, it's internal displacement, but it's also external displacement. So some people are just moving, across their country. Some people are moving outside country lines. And so this future of migration has so many health implications. And then, one of the things that I noticed a lot, which was, just sort of a microcosm of it, I was working in Syria in a humanitarian refugee camp. And we got there with a group of medical providers to provide medical care. And 80% of the population there were women and children. And we got there and we had no OB-GYNs. I'm an ER doctor. So they're like, well, you do OB-GYN. And so I was seeing like 50 patients a day, right? And then we had some pediatricians, but then we had a lot of internists. And a lot of them were men. And here we are in a Muslim predominantly country, and women won't see men for their health needs. So then we're there, right? Totally not prepared to really deal with the situation there. So where were all the men? Okay. The men had left the refugee camp and they were in South Lebanon working in the mining industry in these really, really risky jobs to get employment, right? And so this fragmentation of families, of healthcare, of employment that happens in displacement situations is like, we can barely even wrap our brains around. I mean, that's just an anecdote from this one specific situation. And I think no matter where you go, you're going to find corollary, sort of examples of people who've gotten displaced or in refugee camps, but they're not just going to stay there, right? They're going to leave. And then that creates conflict with the local populations because now there's all this competition for work. And so there's also sort of this civil unrest that can occur because of refugee populations getting displaced and then seeking work, right? Because then it creates this new competition. So there's a myriad of sort of, consequences and downstream effects to think about there. One of the things that I sort of focus on is, okay, well, how do we even provide healthcare to people, in these crisis situations? And it's very tricky. One of the things that I've been sort of strategizing is, one of the things I ran into quite a bit in this particular refugee camp was a large number of health providers who had fled in the midst of their training or already were doctors or nurses, but they fled Syria, but they were unable to work in their host country of Lebanon, where they'd fled to, because of competition from other doctors in Lebanon who didn't want other doctors working in Lebanon, right? So despite the fact that there were massive shortages of healthcare in the refugee camp, they weren't allowed to work. So, I mean, it becomes very complicated very quickly. But I mean, I think that, for humanitarian purposes, we need to be really thinking about how to provide meaningful, safe work to people who are undocumented, and what do those mechanisms even look like? Are they international agreements, and how do we structure them? So it's really complicated. But Lee, I mean, it's a great point to bring up. I mean, I think we're going to be seeing more and more of this in the coming decades. I mean, that's what the data is telling us.
Yeah, and thank you for bringing that up, Bob and Cece, for those personal as well as data-driven insights. I want to bring this back to a very early question that we got nearly an hour ago, and it's kind of a nuts and bolts question, and so each of us have described the need for change, and one of the questions was what the panelists' thoughts are on the impact on worker well-being. I think we've been talking about worker well-being here for about the last 15-20 minutes, but here's the question: what changes are needed if you are doing occupational safety and health management? If you are on the ground, and we heard one thing, which is, stop shutting up. We have to be speaking up. We heard that loud and clear, but what changes are needed in order to anticipate all of these expected threats from an occupational safety and health management perspective? And I've repeated it a second time because I wanted to give you all a little time to chew on the question. It's actually a very it's a complex question for sure. I'll give you just a second to think about. I'll give you a quick example. Coming back to what we've been doing in Latin America. One of the things that we started with was assessing, what's the quality of the water, the electrolytes, the rest, and the shade practices for outdoor workers. Is the water that they're getting clean and safe and free of chemicals and heavy metals and other things that are toxic? If you're having to hydrate at 6 or 8 liters of water per shift. So some very pragmatic things, which are here and now things for those kinds of populations, and are probably going to be here and now in more northern climates very soon. So there are some very practical, taking a kind of traditional hierarchy of controls approach to this, where we ask what are the hazards, and then what are the engineering and administrative and personal protective and educational interventions, administrative interventions that are going to help. I think you can apply those principles to heat and other climate-related hazards. That would be my answer. But Bob, I'm wondering, you've been on the front line of occupational medicine practice for a long time. What would you say back to that?
Well, I would amplify this webinar by about 1,000-fold. I would create what I would call a community of good occupational health practice. Get informed, share information, advocate internally within your organization or among your colleagues, take what works from anywhere and show examples, educate, mentor, so that we grow a global community of people who care about this. There are, of course, a number of funding and public health and infrastructure changes that we could make. But I think from the point of view of what we can all do together, I think, Lee, that you've created a great example, actually, by this webinar. I can just imagine there are folks all over the world who are facing heat-related illness in their outdoor workforce. And asking, okay, what are the best practices? What do I need to do concretely? If I want to monitor somebody for chronic kidney disease, I'm concerned about that. What specifically should I do? Well, I would say, send an email to Lee Newman. Find out what he did in Central America. Get that policy from the company that you worked with. Show it to your company. Show it to your public health officials. I think we have the opportunity to do that, actually, because we have this format 3 years ago, I wouldn't believe I would have been on Zoom with 150 people. I would have been lucky to get 12 people in a room listening to me. So we can do this.
Yeah, I would just chime in, the need to like celebrate successes, right? Like have success stories where, this is working, we can duplicate this and really bring those stories to the forefront of where things are working and how that can be shared, globally. I would also add to this, like how can we increase our impact? And I think about, training health professionals or training nurses or doctors, right? No one is trained in medical school to take an environmental or occupational health history. And most people don't even know that, occupational health is even like an option. Like, I don't even think I knew about occupational health until I met Lee Newman, right? And so, how can we really integrate sort of an environmental and occupational health history taking and have that just be part of what every doctor knows or nurse or clinician knows how to do. I think that's going to become increasingly important and will hopefully, increase our workforce of people who have their eyes on this type of situation.
Thank you. I do appreciate the shout out that we have in the chat as well. That there are resources out there. NIOSH has resources on how to perform an occupational history. And ACOM, the American College of Occupational Environmental Medicine, has a lot of resources around this, as well as around climate change and its health impacts. There are a lot better resources than there used to be, and I want to do a shout out for that. But I wish that we could get to all of the questions and comments that we have in the chat. But one thing that I promised the speakers is that I give them their last shot. So with this last couple of minutes, I want to give each of our speakers 2 minutes to leave us with their parting shot. What's the take home that they, having heard each other today, what would you most like to share with folks before we sign off here in a few minutes? And Cheryl, could I start with you?
Sure. This has been fascinating. And I've wanted to ask a question. And so I'm going to pose this as a question, but it's sort of a bit of an answer towards an answer, maybe to your previous question about what Lee is doing and how do we get word out there and get people on board with that. So as someone who's not in occupational health and safety and not in business and management or finance, I wonder, like I've read, I know about the data that worker productivity is better, sick days are fewer when workers feel valued in their jobs and when their conditions are good. And so my question is, why is it that their employers are so unwilling then to support their own interests by improving? And I mean, this is also happening not just for outdoor workers, but even at the, us in academia, the way the world is moving, and certainly you in public health, which I know for a fact is very short funded in the United States and has been, and we're seeing evidence of it with COVID. So that's sort of my summary. People can respond if it suits them. Thank you so much. It's really been great.
No, thank you, Cheryl. I think we all appreciate that comment. And we know there are organizations out there and people in organizations who intend and want and sometimes actually are doing the right thing. And I think we need to figure out how to multiply that. So thank you for that comment. I think that's spot on. Cece, let me turn to you.
Thanks. Yeah, one of the things I'm sort of thinking about is, how do you make the approach to worker health in a changing climate? How do you incentivize it? How do you create incentives for workers, incentives for businesses, incentives for governments to want to do this, right? Because unless there's either an economic incentive or some other perceived gain, it's hard to get people to do things that require, time, energy, and resources, right? So thinking about, how do we incentivize this? And then, going back to sort of maybe it's cliche, but sort of breaking down silos and thinking about, who else needs to be at the table here? I mean, journalists, right? I don't know if there's any journalists in the audience, but, maybe we need to invite some next time, right? To sort of get their perspective on how we can really communicate better with those audiences. So it's been really exciting to be here today. And it's very cool to see how many people have their eyes on this issue and are tracking it. It gives me a lot of hope. So thank you.
Thanks, Cece. Bob, I want to turn to you.
I always say, when you see something, say something. The power of the story. If we take a visit, sometimes I wish I could take every policymaker and bring them out to an agricultural field when it's 120 degrees and somebody's cutting sugarcane. Lee, you've probably been out there in Central America and done that. And to experience what is that like? What is it like to spend your whole day in an underground mine exposed to silica dust, or get a limb chopped off and not be able to work? So that's always my message, is to talk to the people who are most affected. And as a healthcare provider or a public health professional, if there's something that we see, publish, say something, talk to a journalist, give that information, collaborate, inform.
Thanks, Bob. Dick, you get the last word.
I think the most powerful occupational health story I've heard in the last 2 years was the cover up of the deaths and the serious illnesses in the meat processing plants, the pork and poultry plants. And no one could read this and go, oh, that's okay. People being jammed together, not giving protective equipment, in a temperature that facilitates viral spread. And that was probably a lost opportunity in terms of really improving health, partly because we were under the Trump administration at that time and the rest. But filling those positions along the way and looking for these stories, because workers are seen as somebody else over there by a lot of the American public, and we've got to send the message, that's us. And so as a takeaway, I just want to thank you, because this was very helpful to me. And I'll just say it, as I was agitating, and I will be agitating for part of the National Academy of Medicine meeting to be, of course, it's going to be on climate, but I think one of those 4 sections in that part needs to be on workers in the new climate. And I wouldn't have said that, except that now I've been with you for the hour and I've learned so much. Thank you.
Well, I want to thank you all, and you know, an enthusiastic and highly participatory audience as well. This is going to be freely available. It'll be posted. Share it with your friends, and make good use of it. I put my my email address in the chat. For those of you who know me, I take it seriously. If you send me an email, I'll get back to you. And if there's a question that you wanted to ask, I can then relay it to the speakers. Madison, with that, I want to call this a wrap and turn it back to you. And thank you all for attending today. And thank you very much to the 4 of you. You're amazing. Keep doing what you're doing, please.
Yes, thank you again so much to all of our wonderful panelists, and thank you, Dr. Newman. In the chat, you will see a few different links. As soon as you log off this Zoom meeting, you will be able to complete our post-webinar survey, so please make sure that you do that. The Center for Health, Work, and Environment is also working with NIOSH to plan the 3rd International Symposium to Advance Total Worker Health, and the call for proposals is open for that right now as well. So that link is in the chat too, as well as a few different contact informations for the Center for Health, Work, and Environment and the Center for Bioethics and Humanities. So thank you all again. We will stick around for just a few more minutes to keep the chat open in case you have any questions, but have a wonderful rest of your day. And thank you again to all of our panelists.
Thank you. I appreciate you all. Keep